Hello, good morning to all my dear students. Today we'll discuss about a pregnancy complication which is very important, that is antepartum hemorrhage. What is antepartum hemorrhage? And you should know the definition and its clinical features and complications and the sequelae that is going to happen to a case. The definition is bleeding into or from the genital tract after 28 weeks of pregnancy before the birth of the baby is called antepartum hemorrhage. That means, usually bleeding will not occur for a pregnant woman during the pregnancy, but it can occur after 28 weeks before the birth of the baby. That is called antepartum hemorrhage. That means it is in the third trimester bleeding. The causes of antepartum hemorrhages are maybe placental causes. Number one is a placenta previa. Usually the placenta is situated in the upper segment either anteriorly or posteriorly. But in some situations, the placenta will be implanted in the lower uterine segment, that is called placenta previa. A second cause is abruptio placenta. The placenta usually will be separated in the third stage of labor, after the delivery of the baby. But sometimes there is a premature separation of the placenta can occur before the woman goes into labor. That is called abruptio placenta. Vasa previa. Sometimes there is a placental abnormalities, one which present as a vasa previa. Circumvallate placenta. This is a circumvallate placenta is a placenta. It is an also abnormal placenta situated, and that may cause a antepartum hemorrhage. Rupture of the marginal sinuses. Sometimes in the lower uterine segment, the sinuses will be there that may rupture and cause bleeding in the third trimester. That is, these are the different placental causes of antepartum hemorrhage. Coming to local cervicovaginal causes, one is a carcinoma of the cervix, very, very rare in pregnancy, but rarely we can see such cases where there is a carcinoma cervix because in malignancy there is a high vascularity which will cause bleeding and it will be manifested in pregnancy sometimes. Erosion of the cervix. There is a word called pregnancy erosion where because of the vascularity the cervix is highly congested. Sometimes the bleeding can occur from this erosion. Polyp of the cervix, sometimes endometrial polyp or cervical polyp which may present during pregnancy and which will cause a light now and then bleeding in the later times. Local trauma, suppose any accidental fall or accident sometimes can cause bleeding from the vagina, the latest. Sometimes unexplained, sometimes we may not be able to explain the cause of the bleeding in the later pregnancy. In all the above said causes, bleeding almost always maternal except in vasa previa. There is a velamentous placenta. So there is the bleeding usually from the maternal side except this velamentous placenta where there is the bleeding is from the fetal side. Now coming to the abruptio placenta. The definition of the abruptio placenta is bleeding due to premature separation of the normally situated placenta. Usually in the later third stage of pregnancy the placenta will be separated. Sometimes there is a premature separation. That is the definition of placenta, abruptio placenta. There are three types of abruptio placenta. One is a revealed and one concealed and mixed. Revealed abruptio placenta, where the bleeding is from that can be visible, and in a concealed abruption the bleeding will be present inside the uterine cavity which may not be manifested through the vagina. That is called concealed abruptio placenta. And mixed variety, we can say there may be sometimes there is internal bleeding and also external bleeding, both can be called as a mixed variety. The concealed hemorrhage. The causes of concealed hemorrhages. Causes are intact margins and intact membranes